Lesson 4, Chapter 4 in the Trawick-Smith book is about prenatal development and birthing. And it's really a fun one. The science of childbirth has evolved over time so that what we used to think of as kind of traditional practices have gone through a trend of going more in a different direction on how we should care for mothers and babies, and then they wave back and forth. It's a moving target. It's not just so simple as you go to the hospital, you have a baby. So this chapter gives some good background on some of the controversies, the genetics, the process of birthing, and some of the cultural differences. It's a fascinating chapter. It starts out by talking about biology and the difference between nature and nurture. And some people get those things mixed up. Nature sometimes they think of as nature like out in the world in the environment, and that's not what it means. It's talking about the biology, the genetics of what makes a child. So you get the genes for your hair color and for your eyes and your skin tone and some of the things about, for example, your gender, the biology of what makes, who makes you, that makes you what you are. So that's what's nature. It's the biology. Then nurture, which sometimes people call environment, and that's why they get it mixed up with nature and environment. Nature isn't the environment one. Nurture is what happens to you after you're born or to the mother who's pregnant. So nurture is how we can influence in a more conscious way the development of the fetus and after the baby's born of the baby. And it used to be there was a big debate in many social and psychological circles about which is more important, nature, the biology and the genes, or nurture, what we do after the fact. Well, now everybody agrees both are very important. So we want to take care of everything we can in the environment and nurturing and learning, but also recognize that the genetics is going to have an influence. Some of what this chapter talks about are the hereditary diseases and also some disabilities that can occur because of what's happened in the environment. So if there's a hereditary disease, you may not be able to do anything about that. It's coming down through the genes. If there is something like fetal alcohol syndrome, which is very high in Alaska, and fetal alcohol effects, that's completely 100% controllable by just not having women drink when they're pregnant. And the cost of fetal alcohol syndrome is enormous, both in terms of human development and human potential, because those children's brains are not going to develop as fully as they would if they hadn't had alcohol, the mother hadn't had alcohol. But also the financial cost. There are estimates about what it takes in public funds to help these children over their lifetime. And the last one I saw was over $1 million per child for something that's completely avoidable, completely preventable. So the way children come out can be influenced by the genes as well as by environmental factors. Toxins are another thing. Sometimes there are things that happen in our society where we are giving medication and we don't realize that 9 months later women are going to have children that have been impacted by the things that happened during the pregnancy. The chapter has a mistake in it when it labels its figures. It has two figures labeled 4.1. It's the second one on page 73 that I think you'll find really helpful. It shows in utero how the baby is developing at each stage and what's happening. So when is the baby's heart developing? When is the hearing developing? And it's important to know what's going on because then you can tie back. If mom has a huge stress in her life that impacts her body and then has an impact on the baby, you might be able to tell more about what kinds of things you would look for in the infant development based upon when that huge stress occurred for mom. Mom's health is a big factor in the health of the baby. We have a lot of malnutrition. Unfortunately, it's far too high in a country that has the amount of wealth we have. We have poverty where moms aren't getting enough good food, and we also have excesses where moms are obese and not getting enough exercise. And both of those things can impact the development of the child and the birthing process itself. We also have quite a high number of teen pregnancies. That was going down for about a decade, and that's what your book talks about. Most recently, that has been back on the rise, but we don't know if it's just gone up for a year or two, or if it is actually another rising trend. But those are the kinds of things, as a child development specialist, you'll want to pay attention to. Why teen pregnancies are important is because we have outcomes that aren't as good for babies that are born with teens. They were at one time saying it was because of the mother being too young to birth a healthy child, but that doesn't really stand up if you look over history, nor does it stand up when you look at all the other factors, because many of these babies are born 100% perfectly healthy, and it's after they're born that we see the factors fall into place, where babies aren't getting enough attention, where the nutrition isn't good enough, where there's just poverty, there's not transportation, follow-up on immunizations isn't as good. It's maybe more the economic and social factors that are affecting the health of the babies of teenagers than the actual birthing process. There's some trends in childbirth. One of them is that we're seeing less involvement in traditional childbirth classes. So many people are not going. When I had my first child, we went to class for 6 weeks, and we went one night a week, and then we'd practice in between, and you'd learn your birthing techniques and various coaching methods for the dad and how to prepare for the childbirth. Now, many times they do that in a weekend, or people are choosing not to go to classes at all, but maybe get information off the internet or out of books, and maybe just walk cold into your delivery. My daughter-in-law was a labor and delivery nurse here in Fairbanks, and she said she was surprised at the number of women who came in just not knowing anything about the process, just figuring that their bodies were going to take care of it and the hospital would help them through it. And you can be much more successful at almost anything when you're well informed. And certainly childbirth is one of those things that if you know more, you will have a better process. If you were in my face-to-face class, I would show you 2 movies. One of them is called Gentle Birth Choices, and the other one is called The Business of Being Born. And I'm sure you can get The Business of Being Born pretty easily. It's a relatively new movie, and it talks about how our medical profession encourages things that maybe aren't always the best for mothers and babies in the long term, but it's good for the medical profession. And the Gentle Birth Choices has lots of different examples of birthing options. In the course, I've tried to give you a link to some of those so you can view on YouTube water births and such. It's quite different than maybe you think of childbirth being, so it's worth taking a look at. Another important, you can get both of those, I think, both of those movies on Netflix if you are a member that gets those. And I'm sure you can buy The Business of Being Born probably for $15 or so, I would guess, through Amazon. There are many organizations that support childbirth, childbirth education, prenatal development. One of the best that's been around a long time is called the Lamaze Childbirth Association, and they have a very good site. I've put a link to it on our chapter. And the most important part there is the 6 practices for healthy birth. And you would want to pay attention to those and share those with parents who are pregnant, or even in educating young girls before they're pregnant about the things that they should anticipate and know to do when they get ready to deliver children. So those 6 practices are so important that I've written them out as well as put a link to them, and I'm going to give you a little information about them now. The first one is to let labor start on its own. And that sounds silly, but many, many women have labors induced now. And by having an induction, you go down a different path of medical intervention. You see that very clearly in the movie The Business of Being Born, where they are giving Pitocin to very high numbers, 80-90% of the labors that come into the hospital. They want them to move through and get them out, and so they will induce them with Pitocin or other drugs to get the labor started or to move it along a little quicker. And the Lamaze childbirth education just says, let labor start on its own. That's the way you start down the path of a healthy, natural birth. And the second one is let the mom walk around. Let her change positions. Now, many times if you go into a hospital, they'll hook you up to a fetal monitor. And as soon as that happens, you're no longer allowed to move around. When you are in one position, it's not as easy for the baby to be born. It's not as easy for them to move into that birth canal. And it's not as comfortable for the mom as moving around can be. So the idea of fetal monitors helps track the baby in a way that makes it more convenient for the people at the hospital, because they can just read the monitor. They don't have to come in and listen with a stethoscope and such. But if a nurse comes in, or a doctor, midwife comes in and just listens, that's absolutely as good as fetal monitors. They've done 9 studies. They all showed that, they've done at least 9 studies. That was years ago. They've probably done more since then. But all the studies show that the only thing fetal monitors do is make moms wind up getting more C-sections. Cesarean section is where they cut the baby out instead of letting the baby come through the birth canal. So the third healthy birth practice, according to Lamaze, is to have the continuous support of a coach or a doula. A loving family member can do this. It's someone who stays with you and talks you through. They might massage your back. They might get you a cup of ice. They do things that help you progress. Nurses and doctors will only be there part of the time. Even a midwife won't be with you 100% of the time. But a doula or a coach will be. Many times a dad serves as a coach, but it can also be your mother, or if you have an older daughter, it can be an older daughter, it can be a girlfriend. Many times women work very well in that position. And a doula is a position that is organized to come in and help you. She will establish a relationship with you while you're pregnant, and then carry through the pregnancy and the delivery with you, and then see you through probably the newborn period with your baby, answering questions and such. So she'll be with you entirely through your delivery, and then be available to you a little bit after delivery. In Fairbanks, last time I checked, they were charging about $600 for that service. Many people find it to be very well worth it. The fourth healthy birthing practice is to avoid interventions that are not necessary. One of my stories about this was my sister was serving as that coach for my niece and nephew, and they had decided they wanted to have a natural childbirth, and they had taken classes, they knew the techniques, they were doing just fine, and the labor was developing. The anesthesiologist came in and said, well, you know, if you want pain reliever, you have to have it right now. And Julie said, gosh, no, I guess I better say yes, you know. And my sister said, well, wait a minute, I think, you know, this isn't what you wanted. You had a plan, and you're actually progressing very well. Are you sure that this is what you want? And they thought about it, and they said, well, no, that's not what we want. We're gonna keep going with our breathing and our moving around techniques, and actually we're fine. And the anesthesiologist was pretty huffy about that, and he said, well, okay, I can see who's in charge here. And he kind of stormed out. And you do get that kind of pressure when you go into a hospital, because the anesthesiologist doesn't make any money if they don't deliver anesthesia. And so they will kind of take advantage of the fact that you're in pain, and maybe you're not in that much pain, but they're saying, if you don't do it now, we're not going to be able to help you later. And you might be anticipating that you're going to be in quite a bit more pain. So there's a little bit of subtle pressure. Also, if you've had intervention, so you've been put on Pitocin, you've had a fetal monitor, you're laying on your back, now you've gone down a path where it's not healthy birthing practices, and you might feel you really need that kind of medical intervention to block pain. In fact, if you don't choose that, if you go down the natural childbirth path, your own body creates a response that reduces the pain. So your body will secrete the chemicals that you need. And certainly you can go through childbirth without screaming, without horrible pains that some people depict on movies or in kind of folklore, just by what your body will naturally do. The fifth healthy birthing practice is to follow your own body's urges. So for your position, many women find squatting, using a birthing chair where they're sitting more upright, gravity is helping the baby come out in situations like that. Some women like to be on one of the big balls, kind of their chest over the ball. All of those positions help the baby come down. For a woman to lay on her back with her legs up in stirrups means that the baby has to actually come uphill to get out. No woman naturally chooses that position. That position was developed when OB/GYN, obstetrics, came in as a medical profession, and it was for the convenience of the doctor. That was how they could most easily catch the baby. But it really isn't a natural, comfortable position for women to be in. And so the fifth healthy birthing practice is to be able to follow your own body's urges. The last one is after the baby's born, keeping mom and baby together. And it really is surprising that in this day and age that's still not happening. My youngest two grandchildren were birthed within the last 3 years. One of them's 2 and one of them's 1. And in both cases, they were taken away from the parents before a whole hour was with parents. 20 minutes, maybe, and the baby's gone. They start doing testing and putting in eye drops and a lot of interventions. And best practice says keep mom and baby together. If dad's available for the delivery, mom, dad, and baby should be alone together. Coaches, grandparents, nurses, midwives, everybody get out of that room. Let the family have some special bonding time for at least an hour. Now, in most cases, we'd like to see the baby and mom be able to stay together as much as possible. It's called rooming in. And in many hospitals, you'll see plans that people develop where they say they want rooming in, but it doesn't actually happen when it comes time to it. They kind of whisk that baby away. So those are the 6 healthy birthing practices. We're very fortunate that we have the technology and the skill and the medical professionals so that when a C-section is actually called for, we have the ability to do that and do it extremely well and protect the health of the baby. C-sections are very hard on the mother. Many people do elective C-surgeries now. It's one of the controversies of childbirth. And they don't often understand that this is major surgery. This is going to take weeks to recover from. It probably will impact your future pregnancies and deliveries. Many doctors do not want to do what's called a VBAC, a vaginal birth after C-section. VBAC are the initials for that. Medically, it's fine to do that, but many doctors would rather not take the chance. So making the choice once to have an elective C-section is likely to mean that you will have future C-sections as well. It also means that you're going to have a very long recovery time. You have a much greater impact of, or potential impact of, infection. You'll be much weaker. You may not be able to pick your baby up for something like 4 weeks, maybe 6 weeks. After major surgery, they'll tell you you can't lift things, even, for example, the weight of your baby. So many times women choose elective C-surgery thinking, oh, I can plan when my baby's going to be born. It'll be better for my mother who's coming from South America. Her airplane ticket is going to know for sure that that baby will be born. And it's much more convenient for doctors. They like it. They can plan a surgery early in the morning and not be up in the middle of the night delivering babies. But it has a huge impact. People have said it's better for the baby. What we haven't known is more recent research has shown that when a baby does the natural passage through the birth canal, this is quite new research, that they are getting exposed to bacteria through the mother's body that actually helps their internal organs develop. It seems to create some extra immunities that when they come out in a C-section, they're not given that opportunity. There's also a very good book called The Well-Balanced Child, and it talks about the reflexes of children and when they should be retained and when they should go away. And some of those reflexes are important in the birthing process. And if they are not retained or go away at the appropriate time, you can get links to disabilities. And so birthing, using those reflexes for what they're intended to be used for, may have a long-term impact on the child's health or possibly disabilities. So C-sections and how you're cared for in hospitals, whether you have midwives, which have very good record of healthy childbirth, or whether you have specialists because you have a medical intervention that is truly needed. There are a lot of factors that go into the birthing process. There are also many controversies around childbirth. It starts with birth control. Should it be given to teenagers? Should it be controlled? Should we have birthing practices and sexuality as part of our curriculum in the schools, or is that the purview of the family? The controversies about abortion, everyone's pretty aware of. Assisted reproduction, cloning, testing, genetic testing prior to whether or not you decide to have a birth. These are all factors that relate to prenatal birth and development that are very controversial and are continuing to evolve. So you might want to think about what are the new things that are coming up in birthing and childbirth, and what part would you like to play? You might be interested in being a lactation expert. We'll talk more about that in the next chapter on the newborn.